Right now in this lecture, we're going to talk about the bones. Now, this is just a basic overview of the bones. Those of you that are like anatomy professionals out there, you're like, you're not going over the tibial tuberosity and all that. No, I'm not. I'm just giving a basic overview of the bones of the body. So let's go with this basic overview of the bones of the body. So the first sort of area we're going to talk about up here is right up here. Right up here at the top, okay, this guy, man, you make me feel good. You're just as bald as I am. That's wonderful. All right, well, right up here, this is the cranium. That's the cranium. That's what's holding your brain. Very important there. Now, I am going to go further into all of the areas of the cranium, like talk about the orbits. We'll talk about zygomatic bones, which are here, you know, those kind of things. But I'm going to do that with just the skull itself in a different lecture. So if you're looking for that, look around, you may find it. But right now we're just talking about sort of basic overview. So cranium, right? So cranium, cranial cap. Then this right up here at the top right here, this portion, so bottom part of the jaw here, this jaw, right, this bottom part of the jaw there, that's called the mandible, right? That's called the mandible. All right. Well, what the heck is this part then, the top part of the jaw? Anybody know? God, think about it. Think about it. Maxilla. I heard somebody say it. No, I didn't. I'm recording these by myself. I didn't hear anybody say it, but the maxilla. So you have the maxilla and the mandible, okay? Now, you notice in there, if you look real closely, this guy doesn't have any teeth. You don't have any teeth, sir. No teeth. Did you brush? Did you floss? You have to do that, you know. Brush and floss. Okay, anyway, brush and floss. All right, so no teeth, but we have a mandible and we have a maxilla. Look at that. All right, awesome. All right, going down back over here, let's take a look at the back portion over here. I'm going to come around here. You can if you'd like. If you're not able to see it from there, I'll turn it around for you here in just a second. So what we're looking at is the vertebral column. So let me grab this guy and just spin him around so that you can see what I am seeing. So right here, these are the cervical vertebra. These are the cervical vertebra, okay? And then attached to the rib cage, the portion of the vertebral column that's attached to the rib cage. Let me put him back where he is so that it's easier for you to see. So the portion that is attached to the rib cage, that's the thoracic vertebra, okay? And then down here, sort of at the bottom, right here, right? These are the lumbar, all right? And then the sacrum, this is the sacrum right here. And these little guys at the end, the tailbone, those are called the coccyx or the coccygeal bones, okay? So, we're going to talk later on in another anatomy lecture about each of the vertebra, you know, and what's special, especially about the cervical vertebra. And we'll even talk about fractures and stuff like that. But yeah, this is your vertebral column right here. Now, I'm also going to point out, since I've got him turned around right now, I'm also going to point out the scapula, okay? That's this bone right here. The scapula. All right, so I'm going to turn this guy back around. Come on, turn around there. All right, there we go. Put you down. Okay, so taking a look at the front of this mannequin now, you can see the rib cage. Okay, here's the ribs. So 1, 2, 3, 4, so on and so forth. All right, we can count all of those ribs. But right here, right there, this bone right here, that's not a rib. That's called the collarbone. That's called the collarbone, right? There's your collarbone right there. You know that. Anybody know the correct name for the collarbone? Think about that. Correct name for the collarbone. What is that? We'll come back to it because I want you to think about it. I really want you to think about it. Okay? And so going out here along the arm, now we can see along the arm here, we've got the humerus, this big bone right here. That is called the humerus. Okay, you know your funny bone when you hit it and it hurt. That's a nerve that sort of sits on the end of this bone right here. This is your elbow right here. That right there is a hinge type joint, right? Hinge type joint. And then we've got the radius and the ulna. And people always say, Bill, how do you remember the radius and the ulna? How do you remember them? Well, what I remember is from my thumb, because when I take a radial pulse, my job previously, and still is actually, is a paramedic. So when I take a radial pulse, I take it off of the thumb right there. So that's the radial pulse. So I look for the thumb, and then I find the radius. So there's the radius, and then the ulna, right? Then the ulna. So the radius and the ulna. And then what you've got here is you've got the metacarpals, or excuse me, the carpals and metacarpals. And then you've got the phalanges, and those are the fingers. I can't move my fingers very well in virtual reality, but you get the idea. Those are the fingers. Those are the phalanges right there. The toes down there are also called phalanges. We're going to get back down there in a couple of minutes, but those are called phalanges as well. All right, so now we're going to keep on going down. What we've got here in the middle here, this mid area right here, this is called the sternum. This bone right here is the sternum. When you're doing CPR, that's actually what you're pushing on right there. And then right down here at the very bottom is something called the xiphoid process. If you've ever taken one of my CPR classes or something like that, you know the xiphoid process, because I do talk about avoiding the xiphoid process when doing CPR. And that's because this goes like kind of right into the abdomen there, and you don't want to push on this and maybe lacerate something in the abdomen. All right, so right here, this is the sternum. That's the sternum right there. Pretty neat, huh? All right, so now we're going to talk about the pelvis, and there are parts to the pelvis that we want to talk about here. These are called the iliac crests, okay, iliac crests. This is the pubic bone here in the front. This piece of cartilage here is called the pubic symphysis. That's the area where the two pubic bones come together. That's called the pubic symphysis. Back here, down over here, this is the butt bone, so to speak. That's the ischium. That's the ischium, the butt bone, right? You can kind of feel it when you sit on it, okay? And then moving on down, what we've got here is the femur. The largest bone of the body is the femur. There's the femur, right? There's the femur, okay? The largest bone of the body is the femur. This is the femoral head that actually goes into the hip right there at the acetabulum. It goes into the pelvis right here at the acetabulum. This is that hip area when you hear about like hip fractures and things like that. A lot of times it's going to be right here at the neck of the femur, right, where it comes up to the head. All right, so we're moving on down here. We've got the femur. We come down to here. There's this little cap thing right there. That's the kneecap. That's the kneecap. That is the patella, the kneecap right there. Okay, and then moving down, we've got the lower leg, the bones of the lower leg. So we have the tibia and the fibula. The tibia is the larger of them. There's the tibia right there. And there's the fibula right there, okay? And that goes down into the ankles. So we're talking now tarsals and metatarsals here, okay? And then back to phalanges again. So we got carpals and metacarpals, tarsals and metatarsals, and we've got the phalanges, right? We've got the phalanges. Very cool. Very cool. So did you think about what the name was of the collarbone? If you said clavicle, you are absolutely correct. That is the clavicle. Excellent job for those of you that got that. And if you didn't, that's okay. Don't be worried. Now you know that's the clavicle. That is the clavicle. All right, so that's the basic overview of the bones of the human body. Again, more lectures to come. We'll get more in depth into the areas of the cranium. We'll get more in depth into the ribs. We'll talk about what this white stuff is here. It's cartilage. But anyway, we'll talk about what all of that stuff is right there and why it's there. We'll talk about this right here. We'll talk about what parts of where and all that kind of good stuff. So you got to come back for more. You got to come back for more. Definitely. Come and see it. It's going to be awesome. And thanks for showing up. I appreciate it.